this morning we're going to talk a little bit about wound care. Eh? Wounds comes on the organ we call the skin. You understand? Okay, good. So, a wound can be many things. Ne? It can be abrasion, can be a punctured wound, bites is punctured wounds, ne? Stab wounds is punctured wounds, little bit injuries is punctured wounds, and we get abrasions if a patient falls, ne? The skin, just the first layer of skin is off. Ne? We get lacerations when there's a cut. Ne? And then we obviously get burn wounds, ne?
Yes.
And we get pressure ulcers. Ne? Okay. So before we can treat a wound, we need to know what caused the wound. We call that mechanism of injury. Mechanism of injury. What caused the wound? What is the history? Because you want to know what happened before you start treating. Because there can be a lot of complications. You can see a superficial thing, but in the meantime it was a knife wound, so it goes much deeper, and actually this patient needs to get to a health professional. But the basics, cuts and scrapes, we can handle at home easily. No, we don't need doctors and nurses to help us treat basic wounds. I am not pro salt water to clean wounds. I am not for salt water to clean wounds. I prefer Epsom salts. No? And boil the water and we cool it down, and we use 1 teaspoon of Epsom salts on 250 ml of parboiled water, water that's been boiled before. Because you can easily make the salt mixture too strong and burn the tissue of the wound, and then you've got a problem because that dead tissue will get infected and you sit with a septic wound. Okay. Before you start wound care, you're going to wash your hands, huh? And then you're going to collect everything you need. Yeah, we've got a dressing box, but mostly you have to also check that everything is in your dressing box. Remember, with the dementia patient, you don't want to run up and down because they're not going to sit still for you to become collected. So you want to collect everything you're going to need before starting your wound care. Then you want to tell the patient until they understand that you are going to put a dressing on the wound. That you're going to clean this and you're going to put a dressing on. Please remember to explain to the patient that this will be a little bit painful. If you do not tell the patient that this is going to be painful, they're not going to sit still for you to clean the wound. Because they're not going to understand why it hurts. Because they've got dementia. So we need to explain that I'm going to clean this wound and it's going to be a little bit sore, but I'll be quick. And then usually they hold still. You've all seen me do dressings. Usually they hold still until I'm finished. They shout a little bit, but it's normal for a dementia patient. Okay. So we want to explain to the patient, get all our stuff, and then we want to wash and spray our hands. If you put on gloves, please do not spray the gloves. Please never spray gloves with alcohol. Ever, ever, ever in your life. If your gloves is soiled, take them off, put on a new pair. But never spray gloves with alcohol. Okay, because it releases the latex in the glove and eventually you will become latex intolerant. Apart from the fact that the alcohol doesn't kill the germs on the latex. So rather discard the gloves, throw them away, and get yourself a new pair. You're going to want to wash your hands, and you're going to spray your hands. We've done washing of hands and spraying of hands. Then you're going to go to the patient and you've got everything ready, your solution with which you want to clean, your plaster that you want to stick on. The important thing about wound care is you've got one hand where you're going to take your gauze, your sterile gauze, and you're going to dip it into the water And you're going to squeeze the water out and you're going to transfer it from the one hand to the other hand. And then when you get to the wound, you're going to move from the clean side of the wound to the dirty side of the wound. Never go from dirty to clean. And if you're going to make one movement and throw that gauze away. You're not going to use it like a face cloth, people. No. We're not washing. We're not washing the patient now. So you're not using this gauze like a face cloth. No, please. And a lot of times I will tell you not to sweep over my wound. I want you to just dab. That means I want you to just touch and throw away and take a new gauze and touch and throw away. I don't want you to go and even swipe over the wound. But usually if I've got a wound like that, I will tell you. And then you're going to put Friar's balsam or Tivico around the wound. Please do not get Tivico inside a wound. Tivico is good for small abrasions where only the first layer of the skin is broken. It is no good inside a deep wound because it contains alcohol, which again will burn your tissues. Alcohol, as you can hear, is not a good thing to clean wounds with, even if they do it on the TV with a little bit of whiskey. It's not a good plan. Okay, it's going to go rotten. Deeply. So you're going to put Tivico around the edges of the wound, where you're going to want to stick your plaster. Tivico, in the case of the elderly patients, is going to protect the elderly patient's skin from the plaster. It's also going to make your plaster stick a little bit better. Because you're going to apply it, wait a little bit for it to dry, and you're going to put your plaster on there. Okay. When you remove a plaster on the elderly patient, please remember to support the skin next to the plaster. So you're going to support the skin and slowly remove the dressing. Don't just rip the dressing off, you will rip the rest of the skin off because like we spoke yesterday, the skin will dead because they're old and it's like tissue paper. Okay. A younger person might not enjoy your slow removal of a dressing because obviously it's going to be painful. Just one or two things on the skin there. We've all got skins and we are very, very thankful because the skin protects us against radiation, which is the sun. Yeah? Because otherwise we would get burnt if we went out in the sun. Yeah? Our skins protect our body from losing temperature. No, it keeps us a certain temperature, 36.5 degrees Celsius. Doesn't matter what the temperatures are outside. Our skin tells us a lot of things. It tells us wet and cold, and dry. So our skin also tells us, gives us an idea of our position. You won't believe it. Your skin gives you an idea of your position as well. Our skin is a very, very important organ, and like I've explained before, you've got natural bacteria on your skin, which also protect you from outside viruses and things like that. Therefore, it's important when you wash your hands, spray your hands, that you take care that you don't get cuts and abrasions on your hands if you need to moisturize. Okay. Thank you very much.
Thank